All right, we are live for another local spotlight here on the Arrow Title Services page. Hello, everyone. My name is Lucy McGuire, and I work. Hold on. We've got some feedback from that. Oh, you hear, Paul? Hold on. All right, guys. Technical difficulties. One moment. All right, hold on. There's some technical difficulties. One moment. All right, hold on. Oh. All right, that was me. Sorry about that. Oh, geez. Hello. Can you guys hear me? Can you hear me, Paul? All right. Sorry about that. Yeah, no, there was some feedback coming back in. I could hear myself. Anyways, hi, everyone. My name is Lucy McGuire with Arrow Title Services, and we are here for another local spotlight here on the Arrow Title Services page. Every week, we host a local spotlight with a new business, or not a new business, but a local business along the Treasure Coast of Florida. And we are just wanting to highlight local businesses because us ourselves are a local business, and we care to highlight those who are also doing great things in the community and just hear about their locals, what they're doing, and just more about their business. So today we are talking about health insurance, which I know most people shriek when they hear health insurance. They kind of get like scared, but we are speaking with Paul Gray from the Gray Agency, and he is a plethora of knowledge. So very happy to have him here with us today. Thank you so much, Paul, for being here.
My pleasure. My pleasure.
Yeah. So before we get into the nitty gritty about health insurance itself, I would love for you to talk about just how did the Gray Agency get started here on the Treasure Coast, and tell us a little bit about you.
So I was in advertising prior to getting into the insurance industry. I actually had my own advertising for about 15 years. And then about 5 years ago, sold the company and decided to get back into the industry and gravitated towards health insurance because I felt it was a real area that we could certainly help people out with. A very confusing area for most people. So yeah, so that's what we decided to do, and it's been going really well. We've expanded into a few other things within the industry, but really enjoying being able to help people give them good information.
That is awesome. I love that you. I'm just experiencing all these difficulties today. My dog wants to join in the conversation. He's like, wow, that's great information, Paul. I know you guys also have a dog that's part of your branding too, and all that you guys are doing there. Lily, right?
Yes, Lily. So she's our marketing director. She's a yellow Labrador retriever, and her main function is to sleep all day on the couch and think of ideas. So that's pretty much what she does.
I love that. That's awesome. Hey, you know, my dog is a little bit more vocal, not sleeping as much, huh? But I love that you have that dog piece of your business. Lily is super sweet. I've met her quite a few times. So I love that. And I love just everything that you do in the community. I'm a part of multiple groups with you, and just like how much you are involved with our local community here along the Treasure Coast. But let's talk a little bit about health insurance itself, because I know that people get really confused on how much is kind of out there. There's 1,000,001 plans, right? So kind of what do you guys specialize in at the Gray Agency?
Okay, so what we've really focused on is the private plans. And just so you know the difference between a private health plan and the other plans, you can plan like through United Healthcare, Florida Blue Cross. There's several companies that deal with major groups. Florida Blue plan, you can get that is not on the marketplace, and one that is on the marketplace. And let me kind of help you through that of what that means. Marketplace simply means you're getting a plan that the government is going to subsidize that plan. It's the same plan that you can get if you're not subsidized, but obviously a lot cheaper. As an example, we've had families pay as much as $2,600 a month health insurance for a family of 4. That same family, let's say they've got an income that's below a certain level, could get subsidized in it $500 instead of $2,600. So the caveat there is I tell people, just be cautious. If you are on a plan that's through the marketplace, keep in mind they do not take into consideration your previous year income. It's your future year, which has caused a lot of issues with anybody, especially self-employed people that don't know exactly what they're going to make. All of a sudden, they're excited. They've been successful. They've made a lot of money. And now they owe the government 10 grand because they took a subsidy. So I just caution people to make sure you have a conversation with whoever it is that's going to set you up on that. And by the way, I personally don't do it, but there are people within my agency that do help people on the marketplace with regular Florida Blue plans, whatever it might be. We specialize in private plans. So why would I do that? What are they? Well, basically they're plans that are for healthy people. If you take blood pressure meds or cholesterol and it's under control, not an issue. So typically speaking, for those that are healthy that come onto a private plan versus that $2,600 plan, and why I use that is because I have a client that actually was paying $2,600 a month. We showed them a plan with a private plan. It came out to $680 a month. We saved them over $22,000 a year because they qualified for a private plan. So, there are some huge differences. There's a few health questions that they ask. And, some of the stuff on the private plans, if you're pregnant or need mental health, it's not probably a good plan for you. So really what it does is it covers you for things like telemedicine, very good coverage for the urgent care, and also catastrophic. But it's not going to pick up maybe it's not a $20 or $40 copay. You may end up paying $100 for the visit instead. Just tell people, look at it real close. Look at the overall picture of what is it going to cost you, and then do the math on it. In most cases, if you're healthy, the private plan, from a dollar standpoint of what you're going to end up putting out at the end, works really well.
Oh, okay. So that makes a lot. I'm glad that you broke it down kind of with the whole private plan and the government plan that a lot of people are familiar with. I mean, health insurance has been a topic that it's been like a hot button for quite a few years now. So there are so many different plans out there. And I do think that people really get confused on like the differences between them and just how it's going to benefit them. So I know that it's very much you have to sit down with them, figure out what's going to work best with them, and go from there type of situation. It's not like you can just figure out what you need in like 2 seconds. And I think that's why people get a little bit, because it's so personalized, right? So getting into that point, you do more than just those private plans though, right? Like you have dental plans and all of these other types of plans that you guys utilize at your agency, right?
Yes, absolutely. So we've got actually an amazing dental plan. It's with the Aetna PPO network. So in Port St. Lucie, we did a little search, and there were like 390 dentists in Port St. Lucie that accepted this plan. And think on dental, this is better than most group plans. So you can get a private dental plan that has really good coverage. So a lot of the plans that I've seen out there with groups and stuff, you've got $1,000 or $1,500 worth of coverage, which is okay. But the private plan actually has $3,000 covered, $3,000 stuff. There's $1,000 of ortho coverage there too. If the kids or adults need orthodontics, I know they're expensive, but it's $1,000 it'll cover. And we do also, if somebody's interested in disability income, worried about being disabled, income, we do that. We do a little bit of life insurance for those that ask us. but most recently we've actually started off getting into the group realm. So what we can do is we can do starting about 15 employees right up to about 300 is what this group plan we can do. So really we've got kind of the best of both worlds, because we can actually go into a company that's, let's say they have 50 employees. We can do the group on the 50, and for those that can't afford to put their spouse on it or their child, we can do a private. And if high deductible, we can do an accident or hospitalization plan to match up to that. So there's a lot of different things we can do in that whole environment of group and health.
The group plan, is that technically a private plan? Because you made it sound like it wasn't, because you said there was like you could put someone on a private plan, right?
Yeah, no, the group is totally separate. The group is typically like a group plan. And a lot of employers are familiar with what they call self-insure plans, which means that they're the ones that are taking some of the risk on. Well, this is a self-insure plan through an insurance company. So it's kind of cool the way it's set up. If they don't use all their premiums, they can actually get money back at the end of the year. So, you know, it's just worth a conversation for companies to at least find out a little bit more about it.
Yeah, absolutely. Hey, if any benefit that you can give to your employees, and you know, this time has been crazy too. We are going through like a healthcare crisis right now. So a lot of people should be worried about their health and looking into these options. I think a lot of people also, the misconception that you have to wait until November or whenever it is open enrollment. And I know that your private plans don't follow those rules, right?
We're open 365 days. Actually, just before I got on the spotlight here, I had one of my brokers, because I deal with a lot of brokers. They send me all their health business if they don't do it. I just got her taken care of in a matter of 15 minutes. Her coverage starts at 12:01. So yeah, we can get stuff going for people that want to get it going right away. We can also, one of the few companies that can actually do children by themselves. So if you've got good coverage for you and your spouse, or it's just you can afford it for the kids, a lot of kids involved too.
Very cool. Awesome. So what do you think is the number one question that people ask you?
Number one question. How come private plans are so much cheaper?
Okay.
That's the biggest question. And basically, I tell people we're able to ask health questions. So we can have healthy pick. We don't have to cover pregnancy. We don't have to cover mental health. So really, if you look at that, it ends up, we don't have to pay out for everything. You know, as far as cancer, stroke, people that have that, they're going on the Obamacare type plans or Florida Blue plans. So that pool of risk that they have is much higher. That costs a lot more money. It's basically, what is your risk and how much is that going to cost? I see people go, well, why am I paying for someone pregnant? Why am I paying for someone that needs mental health? And the answer is because that's the pool of risk that is. So on the private plan, they're not paying for those risks that they don't feel that they need to pay for, if that makes sense.
Yeah, absolutely. So pretty much how it boils down to is if you're making, because the marketplace goes based on how much you're going to make, or your salary of some sort, right? Or your income. So if you make a decent amount of money and you're healthy, it's probably going to be best for you to get a private plan, right?
Absolutely.
And if you're making less money and you have health issues, then you might want to wait until open enrollment, right?
Yeah. And there's different open enrollments, and you can have your audience just tell them to give me a call and I'll help them through all that minutia. So which one's it not open? Yeah. But
I know the paths of insurance is super fun, super exciting. That's what I tell people. I'm like, who's excited to talk about title insurance? Yeah. But title insurance is different than the insurances that you sell. And I think we get lumped into it. They're like, oh, insurance, I don't want that, or I don't want to talk about that, or whatever it is. But it's completely different. So I'm glad that we can hash out the different insurances that you do compared to what we do as a title company in real estate, which is completely separate.
One of the things I pride myself on is keeping it insurance language itself, so most people don't understand stuff. So by the time we have a conversation with my potential client or someone that's looking for information, they know exactly what it is that they're getting and what's covered and what's not covered, because that's very important for them to know what's not covered. And I tell them, hey, you're going to always have my cell phone number. Call me anytime. I ask at 3 a.m, somebody better be in the ER. And they laugh.
Oh my gosh, that's funny. Yeah, no, I definitely, I've known you for quite a bit, and you've been super helpful. And how you explain things is just, I think that's really what it comes down to when it comes down to any information that you get, right? About anything that, we had Dr. Chad Need on the other day, and just like any information that you get, it's about how it's explained and making sure that the person that you're speaking with is going to explain it in a way that they can take in that information. So I know that you do a great job at that, and very thankful to know you and know that you always handle your clients with such care. So what do you think it is that most people are worried about when they get into the whole insurance thing? Like, what are they just most worried about?
I think they're most worried about what's going to be covered.
Yeah.
It's a big thing is, what is it that's going to be covered? Now, the good news is that even private plans don't typically cover like your wellness and that kind of stuff. You still get discounts and all that, but there are a lot of options. And for those of you that have no coverage out there right now, feel free to contact me. I'll give you some great advice, great places to go for if you need an MRI, if you need a mammogram, if you need blood work done and you have no insurance. For example, I'll give you this tip right now, jasonhealth.com. You go there, you can click on that you don't have coverage, and then you tell them what kind of blood work you want done, whether it's a wellness panel. I know I went on there personally. I went on wellness panel for a male, diabetes check, and prostate check. The whole thing, everything, $50.
$50?
$70
70
for everything, paying cash.
Wow.
To go to any Quest, because they've got an affiliation with Quest. So have you ever heard of Goodrx?
Yeah, the Goodrx plans. It's like an app,
so Goodrx
right?
do a lot of advertising. Basically, what they do is they negotiate pricing with all these pharmacies. So, and there's another one, folks. If you don't have Goodrx on your phone, put the app on your phone. When you go to the doctor, open the app and type in what prescription you need, and it will tell you where to go that's the cheapest. I take a few different meds for blood pressure, cholesterol, and that kind of stuff because I eat bad. I'm with a Hispanic lady that cooks a lot. What can I say? So
good food. It's good soul food.
Good food. So I have 4 different meds I take. It's $30 for 90-day supply through Goodrx.
Wow.
So even when I had a Cadillac plan with Blue Cross of Vermont, whatever it was still cheaper for me to use Goodrx for my meds. So Goodrx is a good one, and jasonhealth.com is kind of like the Goodrx of blood work, really.
Oh.
And mammograms too. You can get a mammogram in Port St. Lucie for $99 cash.
Wow.
MRIs for $250. So I've done a lot of research for my clients, so that if they need something done, I tell them, call me first and I'll tell you, where exactly to go. So that goes back to your question. What's the biggest concern? That's the biggest concern of where do I go for certain things? But there are options if you're not insured out there that you can get some of this stuff done very reasonable.
Yeah, that's awesome. I love that you do that for them, and continual resource. It's not like they're just signing up for insurance and that's it. Like, bye, sayonara, have fun. Like, it's continual aspect, because I mean, that's, our health is always being put at risk, pretty much. Like, you could eat 50 donuts a day for a month and probably have an issue. So maybe a little issue. That's awesome. So, how do you think COVID has affected the whole health industry as a whole?
That's a good question. And I've been kind of trying to pay attention to that. So pretty much all the insurance companies, including the private ones, do not charge anything for the COVID testing.
Yeah.
And you might need one just to travel with Traveling Lucy, or you're going whatever. And our, the company I deal with, that's fine. They do the testing, no charge, or they pick up the charge. You have to put a claim, like run it through the insurance, but they're not charging for that. So I think that have an impact. Impact on COVID. We have a preferred rate, and one of the questions is, do you take blood pressure, cholesterol, depression, or anxiety med? They were actually looking to lift the anxiety med one because of everybody on anxiety meds. So, it's affected that. It's going to be interesting to see how it affects the rates once it's done, because a lot of claims are going through now.
That's true. Yeah.
So the insurance industry really hasn't seen the impact yet of the bottom line on their bottom dollar. But I think going forward, you'll probably see some of so there could be some increases down the road because of it. But
yeah,
it's a guessing game. Although, COVID's been really bad, but now all of a sudden the flu went away 100%. I don't know where it went, but it's gone now. Part of people say, everything's COVID now. So part of, I think, what's being spent on it is stuff that would have been spent on the flu as well, because a lot of stuff is being tagged COVID, and I don't see too many flu cases because people were dying of the flu, every year.
Yeah.
So it'll be interesting to see. I'm not the guy that does those numbers, but just kind of keeping an eye on it. I think they'll see some increase on the road because of it.
Yeah, probably. I mean, there's a lot of increases going around just because of everything. Like, COVID has affected so many different industries, and some of those increases are happening like now that it's been over a year, which is insane to think about. I can't believe it's been over a year. It's crazy. It's like,
so I was listening to a guy yesterday talking about lumber building costs.
Oh yeah.
So,
yep.
A piece of lumber for framing used to be like $2.20 or $2.50. Now almost $8.
Wow.
For the same wood.
Yeah. I mean, material costs.
Yeah,
like the whole real estate industry, like material costs for things, in the sense of, building houses. I mean, even appliances, because they're building houses so quickly and they need appliances for the new houses. It's like,
can't even find
all
fridges.
These little trickle effects.
Yeah.
It's crazy. So we'll see how it trickles into insurance. But it's good to know that, hopefully maybe there's some type of leg up in getting insurance now and not waiting, because the plans last for a year usually, right? Or is that not, what's the case with private plans?
I'm glad you said it. Let me clear up a misconception.
Oh, okay. So
there's a misconception because the private plans typically, for the most part, are called short-term medical plans. Okay. The word short-term came before, when the plans were only able to be written for 90 days. Went away back in, I don't know, whenever it was that Trump got in, that went away. And so then they went to a year plan. Now we can write a plan for up to 3 years at a time, locked in. Rate locked in, insurability locked in. So it's great for people that are like 62 and want to get to Medicare age. So just know that short-term plans aren't necessarily short-term plans.
Yeah, I guess it's all relative, right? Short-term. 3 years of my life is nothing. It's a short-term piece of my life.
Most of them are a year is what they're set up for. Yeah.
Okay, cool. Very good to know. Well, I'm glad I brought that up so you could bring that up. Awesome. So is there anything else that you think people should really know about in regards to just insurance that we haven't really already discussed?
Stay away from the internet. Try and find somebody that's local that you feel you can trust to get through all of that. just with somebody else. I'm always here that if you want just to talk about it, not a problem. I think I sleep this stuff, my mind all the time. So I don't mind giving out information because our business is a referral business. We get a lot of referrals, not necessarily from the one that was a client, but people that we actually gave some information to just to help them out. So just find somebody local so you're not trying to deal through all the internet stuff. We know everything on the internet is true, right?
Absolutely. I don't know what you're talking about. I mean, we're on the internet right now, but this is true, guys. Yeah, no, absolutely. There's so much information that you can get from the internet. And I always, even in our Market Update Mondays and Thursdays, top tips in real estate, when it comes to real estate, I think when it comes to anything, if you can support local, especially during these times with COVID and everything like that, if support your local community, support local people who are making things, who are businesses locally, just because one, you're going to get more up-to-date information of your local area, and two, you're supporting those local businesses, which is why we started this local spotlight, to highlight businesses who are, true and honest companies in this local area and just making a difference in our community. I know that you're very involved in the community as well, Paul. And is there anything that you guys have coming up that you are involved with that you want to kind of throw out there?
Well, we just kind of got introduced to a new organization. It's called Graceway. If I said the full name of it, but basically they help underprivileged kids and adults, and they feed them, and they've got stores there that they can walk in, and they set it up like Plato's Closet. I've never been in one, but Plato's Closet. So it's a very very nice for them to go, and they're not paying for clothes. They go in there and they get to shop. So for those in that, lower income bracket that can't afford, that aren't as fortunate, what a wonderful organization.
Wow. I love that.
They were feeding people 7 days a week. Now I think they're back to about 3 days a week. But they've got, a little store. So if you've got clothes or anything like that, what a place to do. And start donating some more clothes, probably some money and some time there as well. So that one, and DDS for Vets. We're going to a thing tonight for them. They help vets get dogs, like service dogs. And big dog person. My labs that I have, they all come from a bloodline of diabetic service dogs. So it's got tugs on my heart a little bit, especially with the veterans. I mean, we got to take care of our veterans. They're the ones that are the only reason that we're having this conversation as free as we are is because we have veterans.
Of course.
So we got to take care of them. So those are the two things that we're really kind of getting involved in or passionate about.
I love that. And it's always good to see companies giving back to local organizations. DDS for Vets, we've had her on to this local spotlight to highlight what they do, which was just incredible. Her story for that organization, Deb Doherty, is just incredible. And then what was the name of the other nonprofit you said?
Oh, Graceway Village, I think it is.
Graceway Village.
I think that's what it is.
I love that. That's all right. I love that just because, I mean, we all have these places that you can like sell your clothes to or whatever it might be, but knowing that your clothes are going to at people who actually need it, I know I'm going to be going through my closet soon.
We did a tour there last week, and it just blew us away. And the person that was there, She just blew us away on what her heart was, and so yeah, just a great organization. What was the other thing? Man, I got a great memory, but it's just really short. Happens when you hit 50, kind of goes away.
Maybe. That happens to me. I'm not 50 yet.
Yeah, you're not there. You're not there.
I'm over halfway there. That's funny. Well, I love that you're so involved in the community, and Paul, you truly are doing great things for our local community. A lot of people know who you are already, but in case they didn't, that's why I wanted to have you on here, because there's always more people that you can help, and I know that you just have a great giving heart that you want to help other people. So I appreciate you taking the time to be on here and share some of your local business and what you do in our community, as well as just helping people through one of the craziest things that we're dealing with right now, being health. And I know I'm thankful for you, and I know that others will be thankful for this video. So appreciate that. And I want you to tell people, how can they reach you?
Okay. So pretty easy. Just give us a call at 724464142. Oh, it popped up. That's magic.
I know. Look at that magic.
So give us a call there, and we can have a conversation, see how we can help you out. The Gray Agency LLC website, Facebook page. We've got all kinds of different things to get to us by. So yeah, give us a call, see if we can help you out.
Love that. And I got your email up on the screen as well, Paul at thegrayagencyllc.com, and Facebook is the Gray Agency LLC. So make sure you guys can see that here. You can also find that in the description of this video. You'll find the links to all of their social media, to their website, their phone number, their email, and you can reach out to Paul and have that conversation, which is free, I presume, right? So
Absolutely.
A free conversation. Yes, free conversation. There aren't many things in life that are free, but a conversation is definitely one, especially with someone who is wanting to help out and just give you information. So thank you so much, Paul, for joining us here today for this local spotlight. We do go live every week with different videos. We have Market Update Monday, Thursday's Top Tips in Real Estate. We also have this local spotlight that we do because we want to highlight these local businesses in our local community here along the Treasure Coast of Florida. So we hope that you guys enjoyed this video. If you did, make sure to give it a like. And also, you can always watch the replays on our Facebook page, but also our YouTube channel, Arrow Title Services, where you can check out all the other local spotlights that we've done with local businesses, as well as learn more about title insurance and see just all the things in real estate that we do as well. That is at Arrow Title Services, that you can find all of that information. We're on Instagram, Facebook, all that jazz. And we're always just here trying to help the local community as well, and highlight the local folks that are doing so too. So
and you guys, let me go. They are the best at information on title. I mean, when she says get excited about title insurance, at first it's so exciting. Then she started talking about it, about a house that we're looking at, and I was excited. So
I love it.
Anything title work done, they are the people.
Oh, I love that, Paul. Thank you so much. We appreciate it, and we just want to help educate people just like you do. So, you know, it's good people helping good people. That's all it is. Love it. Well, thank you so much, Paul, for being on here. Thank you to all of you guys who are watching. We hope you will tune in again to our other live videos that we do. And we also hope you have an amazing rest of your Friday. And we'll see you guys next week. Have a great one. Bye.
Bye.